Hi, everybody. My name is Nick Brodnicki,
And I'm Avery Dukes.
and we are coming to you from the Oregon and Southwest Washington team for the American Heart Association. Today, we just need a couple minutes of your time. We really want to focus in on the concept of understanding, managing, coming up with some solutions around chronic disease with your employees and your craft. And we definitely need to level set if we're going to talk about topics this big. So, Avery, can you help us when we say chronic disease? What do we mean?
Well, the American Heart Association defines chronic disease as a condition that develops over time and may take a long time to treat. And this is about the same definition as the CDC, who talks about conditions that last 1 year or more and often require ongoing medical attention or limit activities of daily living. And what's wild here is that about 60% of adults and 80% of Americans 65 or older have at least one chronic condition.
Okay, that's going to mean a lot of folks on our job sites are going to have a chronic condition, both on the job site and in the office. So, what are we talking about? What kind of diseases here?
Well, just to touch on a few, we're looking at hypertension, which is high blood pressure, high cholesterol, arthritis, heart disease and heart failure, diabetes, chronic kidney disease, and even depression. So, Nick, when we're thinking about all of these diseases, how can managers work to mitigate chronic disease for their employees and their craft?
I love this question. There are so many directions to run, Avery, but I'm going to focus in on three with the time we want to take today. And I want to talk about the concepts of visibility, policy, and programs. Visibility being the biggest of all, because if something is visible, if it's out there, if you talk about it, if you can find ways to measure it and see it, it's much easier to address. So we can bring up leadership and management can bring up the concepts around chronic disease during a stretch and flex. Not only are you doing things to help mitigate chronic disease, but you're also creating an education moment, places to keep bodies and minds moving at the same time. Things as simple as suggestion boxes go a real long way, asking folks if they want to put in some anonymous support ideas. And from the ideas, the education pieces become so important to mitigating chronic disease or the results of it. Because if somebody is suffering from something already and your crews are educated, they're going to have the opportunity to spot something and respond more quickly if someone is undergoing some sort of acute issue on a site. Now, this also leads into policy, and this is where you can make overarching impact across multiple job sites, multiple crews, multiple office sites. Because if you can encourage folks to think about maybe the different foods that they're eating, they might be doing a pretty good job already, but everybody, including us, can do a little bit better. If you can encourage them, and if you can think about, the food trucks that you bring on site, or the catering that you have in places, or your tobacco policies, that can go a long way in mitigating chronic disease for everyone. And a smaller scale version of that is also often the programs that can be implemented. And I know, Avery, you and the Heart Association have done a lot there when it comes to blood pressure screenings and giving folks access to their numbers. It's a pretty low barrier to being able to manage a lot of this. I think working through visibility, policy, and programs there, by doing those sorts of things, by keeping our bodies just a little bit healthier, our minds just a little bit more educated, no matter your weight, no matter your age, folks can keep cholesterol down a little bit more. They can help reduce a risk of diabetes. It can potentially lower risks for so many of the other diseases that you brought up. Now, that's a bit of a statement, but I'm also going to say, Avery, do you generally agree with all of that?
Absolutely.
Okay, so I think I touched on a couple of the things I'm going to ask you about now, but what does the AHA want us to avoid if we're going to talk about all of those mitigation things that leadership is probably just doing at least a little bit around each of those categories.
Well, like you mentioned, we want folks to avoid tobacco, whether that's chewing or smoking it. Overly processed foods are a big thing that we would love for folks to avoid. So, like you mentioned, really just encouraging healthy snacks and trying to think about what is on the job sites. Of course, we want folks to avoid excessive alcohol use. And for managers and for craft and employees, it's just important to remember that moderation and variation are key.
I couldn't agree more with that last point. I like those specifics. We really want to focus in on the positive, what everybody's doing right, but we can bring in little elements of what we really want to make sure we avoid as often as possible there. If we wrap up on a positive note here and we all walk away with your biggest tip for leadership, what would you have to say?
Well, I think it's important to remember that days are long and work is hard for you, for your employees, and for your craft. And you're probably managing to many of the right things, but tiny changes and continual improvement will make such a difference in helping you help your employees avoid feeling the effects of chronic disease. You can definitely manage all of this.
Yeah, I think we can all manage this. I appreciate how we ended on that note there, Avery. And for everybody who listened in today, if you're looking for more resources or ways to approach some of the visibility, policy, and programmatic elements to the work that Avery and our team in Oregon and Southwest Washington do, you can check out our Hard Hats Hub online. Use your internet browser to find that. And partnering with the AHA goes a real long way in creating sustainable changes for your entire companies. I want to thank you so much for tuning in and keep doing the good work.